Welcome to the presentation of the Scoping Review. Impact of fast mimicking and fasting interventions on enhancing cancer outcomes in adult patients. Cancer remains a leading global cause of morbidity and mortality, with significant challenges such as treatment-related toxicities that impact patients' quality of life. Traditional therapies, while effective, are often associated with adverse effects. In light of these issues, fasting interventions have emerged as a potential avenue for improving cancer care, prompting us to review their clinical evidence. Therefore, the focus of this review was to assess the current evidence on the impact of fasting mimicking diets and other fasting interventions on outcomes in adult cancer patients by analyzing clinical trials that used this type of dietary intervention. We conducted a comprehensive literature search in PubMed, Cochrane Library, and Embase, which yielded 5,776 articles. After removing duplicates and screening titles and abstracts, 95 studies were fully reviewed. We applied strict inclusion and exclusion criteria, comprising randomized controlled trials and other interventional studies, focusing on adult patients diagnosed with cancer and undergoing contemporary treatment, while excluding observational studies and those involving children or animal models. We performed data extraction using Covidence to ensure systematic collection of relevant information about each study, and we assessed its risk of bias using the Cochrane ROB1 tool. In the end, we identified 10 studies with 696 patients that met our inclusion criteria. These studies were heterogeneous in terms of their designs, patient populations, and outcomes assessed. There is also variability in fasting protocols, including fasting mimicking diets, short-term fasting, and ketogenic diets combined with intermittent fasting. In addition, the majority of studies raise concerns about bias. Although some studies suggested that fasting may lead to improved overall survival, enhanced quality of life, and or reduced chemotherapy-induced toxicities, these findings were not consistent among the available studies. Overall, the evidence suggests that fasting interventions may be promising adjunctive therapies in cancer treatment, especially improve treatment efficacy and reduce side effects. However, we identified limitations due to design's heterogeneity and methodological quality of the studies. In conclusion, although fasting represents an exciting frontier in cancer treatment, current evidence is insufficient for its widespread clinical adoption. Further well-designed studies are needed to validate these findings and, thus, justify the use of fasting protocols as an adjuvant in the care of cancer patients. Thank you for watching me. And thank you, Group 14. You are outstanding.